I'm here to help women reset and rewild, to embrace and prioritize the pauses in order to reclaim their peace and power. I'm Dr. Michelle Paris, director of the Poppy Clinic and founder and CEO of the Wild Collective. As a disruptor, naturopathic doctor, wife, and mama, I've created a global movement and sacred space for women to rise together. Here, you'll break through limitations, romanticize your life, and unlock the magic of your divine feminine power. My life's work is rooted in community, lifting women into their most powerful, authentic selves, while empowering clinicians to elevate their practices with a transformational, community-driven model. I lead a thriving, passion-fueled business and naturopathic practice brimming with abundance, where I can guide women to invigorate their lives through sisterhood and elevate healthcare with a cutting-edge transformational approach. I've witnessed firsthand in my practice how this model sparks consistent health transformation, creates flourishing communities, and brings profitable success. You can have it all, a life filled with abundance, contagious joy, and untethered potential. So pull up a seat. It's time to pour into yourself and tap into your intuition and design a life that's wild, free, and uniquely yours. And I'm going to show you how. This is Wild Medicine.
Hello and welcome back to the Wild Medicine podcast. I'm Dr. Tara and Dr. Michelle is away today. And so I am so excited to have a very special guest joining me. Dr. Kirsty is joining me today. So Dr. Kirsty Gaylor is a naturopathic doctor with over 10 years of clinical experience. She has a bachelor's degree in food and nutritional sciences and a naturopathic doctorate degree. She maintains a broad family practice, supporting patients of all ages, all the way from prenatal care through to their 90s. She is also a devoted single mother of two. Her life experience has shaped her deep respect for resilience and boundaries. After living in Costa Rica, where she built homes, ran a restaurant, owned an apothecary, and immersed herself in the physical discipline of surfing, she returns to Canada with an instinct-led philosophy shaped by life close to the wild. Her clinical work bridges plant medicine and advanced IV nutrient therapy, with a focus on physiological restoration and resilient health. She believes true healing requires integration of mind and body, and she creates spaces where patients feel heard, safe, and empowered in their own biology. She practices collaborative medicine that strengthens autonomy and self-trust. She's less interested in managing symptoms and more committed to cultivating abundant vitality, because healthcare should not aim for barely functioning, but for resilient, optimized, and expansive health. So, welcome, Dr. Kirsty, to the podcast. I'm so excited to have you today.
Thank you. Me too. Me too.
So, if we go way back, you were actually a member of the Poppy team many years ago, even before I was a team member there. And so let's start there maybe. How did you first discover Poppy? What did that look like all the way back?
Yeah. So I had been practicing for however many years, and I got IV certified and licensed, and then I was looking for a clinic to kind of practice in, and I somehow stumbled upon Dr. Michelle's and just like fell in love. Like she just had all the words that it was like Wild Collective, women empowerment, all of the things. Like she just had such a magnetic energy, and I was like, this is where I need to work. And I was even shy, like emailing her because did I email or call? I can't remember, but I was just like, hi, I really wanted to focus in on IV therapy and wondering, there was no posting of a job, no nothing. And I just was like out of the blue emailing her. And she called me back, like, I want to say in an hour. Like it was something like I was not prepared for. And she's like, yes, I am. Like, come in. And yeah, I think we just hit it off from there. So I started doing IVs for her for a few years. And then life shifted me a little bit to Costa Rica, which we can chat about. And then now I'm back. So yeah.
Amazing. And I was telling you just before we hit record that I think you probably left probably just right before I started there.
Yeah.
And yeah, and I was helping Michelle with IVs back then. And she was always saying, Dr. Kirsty's the best at IV. She's so talented,
Oh my
all the
God.
things. So
Yeah.
I'd heard about you. And so when you came back recently, I was just so excited to meet you. And
Yeah, and it was a similar return in that, like, I had gotten back, I didn't even message her in advance, and I just woke up one day and I was like, "What's Michelle doing? Like, let me message her." And then the same thing, she's like, "I was looking for someone." So, yeah, that's how you know it's aligned, so mm.
absolutely. So meant to be. So meant to be. And I would love to chat a little bit about Costa Rica. I've been to
Yeah,
Costa Rica a few times, and what a magical place. I can only imagine how magical that experience must have been, living there, practicing there, and really immersing yourself in that culture. So I would love to hear about that and just even how it changed you as a person and changed your practice and
yeah.
some of the lessons you took away from all that.
Yeah, thank you. Thank you for asking. Because, like, I would say it definitely leveled me up in my human experience, that's for sure. So, it's interesting that you say that you went on a trip because it's like that's when I think about or how I would describe Costa Rica now is it's like a Venus flytrap.
Mm.
People go and they're like, "Wow, this is paradise. Like, look, it's so magical. Like, people are pura vida." Like, that's
Yeah.
sort of like what they say. Like, everything is pura vida, which is like pure life, you know? And you're like, yes. And it's just like the food, the people, the sun, the beach. And then, you go there and people are like, I need to live here now. Like, I just need to live
Yeah.
here. Like, people will go on a 1 week trip and buy a house and then be like, I'm just going to live here. And it's like, who goes on a vacation and then just buys a house there? But it's like a whole country of that. Or I guess like the community I was in, it was that. And then it's interesting because then you move your life there and then the land is like, okay, bring out the dangerous insects and animals and
Mm.
let's show her all of her shadows all at the same time. And you're like, oh my God, where's the pura vida? And so, yeah, it's a really healing place, but not healing, I would say, in the like all rainbows and sunshine kind of way. It's like really tests you and I think brings out your shadows for you to face and healing in that perspective, if that makes sense.
Yeah. Wow. That's
Yeah.
beautiful.
Yeah. So, yeah, I would say that like how did it has changed me as a person on a like down to like I feel like a cellular soul level. So, yeah, as I said, I mean even the word and the idea of wild, right? Wild to me used to be like shake my hair and like go out with the girls, like wild night. And wild and then it like made me really redefine that in that, wild is when I was living there, like you are next door to the wild and it's sort of like you are at the mercy of Mother Nature and the wilderness. And so every day is interesting. So a couple examples. I had a home. I was like laying on the ground, doing some sit-ups, laying down, look next to me, and there is a tarantula the size of
No.
the size of my head. I was like, "My God, it's an animal. There's an animal in here."
Yeah.
And I'm like, wild is like, my daughter's screaming and she just got bit by a scorpion.
Oh,
Wild, like I come home and I look outside my home and there is a pack of 20 giant coyotes. And
wow.
you're like, how am I getting in?
Mhm.
And so it has this wildness about it. And I'll talk a little bit about surfing as well, because I
Mm.
think that really is another sort of way to express it in that like it has such a wild energy to do the sport of surfing. And that's why I said, it's like a physical discipline of surfing because it is a sport where again, like the waves, you are at the mercy of Mother Nature. And it's an interesting sport because every time you go to play, you could die. Like a wave can come and drown you. Like the amount of times I was like pinned under, fell close to a rock. The craziest was like one time a wave was coming. It was like so beautiful. The sun was shining. I went to like dive under and like a huge shark just swims across the wave.
Wow.
And I'm like, oh my God, you know? So it like redefined my idea of wild as being this thing of like, whoa, like all fun to like that edge of danger, right?
Mm.
Like how close life is there to this line of sort of intensity and danger. And what that does to you after a while is it absolutely makes you live in the moment. Like you realize there is no space to be distracted. There's no space to be anything else but in that moment. And, you know, it is like life or death moments that happen quicker and more frequently. And it's just an interesting way to live that I think really shifted my existence because, you know, being a mother of two, a single mother of two, working, wanting to surf, wanting to do all of these things, I soon realized, you know, after burnout, after burnout, after burnout, you know, like you have to be so present. And what needs to lead in everyday life is your instincts and intuition.
Mm.
And and there's no way to sort of survive that place without having that at the forefront, to be honest, because you really are faced with these intense situations on a regular basis. So I'll sort of digress and come back, but what started out as like my obsession over surfing, which again is that idea of like you need to be so present and so there when you're surfing because it is this dangerous, like wild sport. And I became so obsessed with it because, well, I don't even know why. Like it was just like it caught me and it entranced me. And so I started to realize like, okay, I need to be so at my physical peak to do this sport. And I really want to do this sport. And so I started to have to really look at how I was treating my body. And what sort of came up for me is this idea of like how self-abandonment is the word, right? Like how was I like abandoning my body and sort of not treating it and not loving it because like I really need it to perform in these moments, you know, and well, all the time. But and so I really just started to shift and every day, like just treat my body like a temple. Like I was like, I need you to be focused. Your instincts and intuition has to be so clear. Because if you mess up, it's a big mess up, you know? So yeah, I just cleaned out everything that could possibly have cleaned out, like everything down to like no alcohol, even coffee before I surfed. It was like, nope, that puts me too much in adrenaline. Like matcha green tea it is, you know, like fruit and so many like just super clean things that, and I just really moved in a way that first honored my body, you know, first really honored my body. And I kept saying, don't, yeah, I don't know. The word for me is like self abandonment, you know, like you can't abandon like the beauty that is taking care of your body. And so I lived that way. And that's sort of what helped my instinct to become so loud and so clear. But then the interesting thing is I always say this to patients, like where your body goes, the mind flows. And
Mm.
so as you start treating your body this way, you then start to see like, how am I treating my mind? And how am I abandoning myself mentally, right? Negative self-talk, fear, doubt, poor confidence, all of those things. And you need to clean that up as well, you know? And so it started to seep into my life there. And like, again, like in surfing, not to keep bringing it up, or like in life and in caring for your little ones, you know, they get bit by a scorpion. Like you don't have time to doubt or fear. Honestly, you really don't. Like you need to act in that moment. Or like there's a snake wrestling your cat. Like, you know, it's just there's no time for anything but confidence and intuition and instinct. And so then it seeped into my mind to be that way. And then, you know, what's the next place after that? After you clean that up, it seeps into your soul,
Mm.
right? And it's like, how am I abandoning myself on a soul level, right? Between my heart, relationships, life path, all of those sorts of things. And, you know, I'm speaking like about this progression of a series of events, but that was like that was a 10-year shift. Like this wasn't like 2 weeks or 6 months kind of thing. This was like a 10-year shift of sort of like treating my body with honor.
Mm.
Then it goes to your mind and then it sort of goes to your soul. And so, yeah, it really impacted me in that way. Like now that I'm back and I can kind of like have that chapter be closed and you look back and you reflect and, I come back to Canada, which is where I'm from, and I feel like a foreigner here. Like I feel like a foreigner back in this country, and I'm looking around, and this idea of instinct, and intuition is so interesting to me because without knowing it at the time, it's like that is the loudest voice for me now. And I come here, and it's interesting because every day I see patients, and I don't know if you have the same experience, but every day people say to me, I'm lost. I don't know what to eat. I don't know what to exercise. Like I'm lost in what to do. And it's just like this disconnect that we have, or that people have, of like just the basics, movement and what to feed ourselves and how to feel in our bodies. So yeah, it's like a huge area and a huge topic now, and kind of paradigm shift, I guess you'd call it, in how I practice and how I serve people and how I guide my patients to sort of reconnect with themselves. So, yeah.
Wow. Wow. What a transformative journey that was for you. And
Yeah.
I'm so curious about, you said coming back here, you felt now you kind of feel a bit like a foreigner. Did you feel that initially when you moved to Costa Rica? Like what was
Yeah.
that transition like?
Yeah. Like you are, they have all sorts of words for it,
Yeah.
extranjera, gringa, all of the things. And especially because there's a huge culture of people coming on vacation, thinking that they're going to make it and come. And then it's like, honestly, the land, like, is incredible. Like Costa Rica is so healing, but in that way that, as I said, like it just like brings out what needs to be dealt with. So, like you go there and there's kind of like, you see people and you're like, they're not going to last, like they're going to be out of here as soon as they get that like first snake or scorpion or whatever. And so there's like an initiation process culturally, I think. And yeah, I mean, of course, as a foreigner, like they're pretty open, I would say, because the town is, that's a whole other discussion, but it's like locals and foreigners very much mixed. But what's beautiful, I think, is that like surfing is at the center. Well, in my world there, like it was a huge part of that culture. And I think, I'm someone who really was is about integration. And so I integrated into the community. And I think surfing really helped with that because it's just like, oh, okay, you're all the same when you're out there, like you're all the same. Like it doesn't matter you're from here, you're not, like you are versus the waves. And then I think learning the language as well, right? Huge barrier, huge undertaking. So that took a while, but I think too, the second you learn the language of a place, it just integrates you even more. Yeah.
Yeah. And you owned an apothecary while you were. What
Yeah.
was that like? That must have been such a unique way to really connect to the earth and the herbs and all the things there.
Yes, I am definitely like a witch at heart. So it like brought out like my inner witch, which was so amazing. And yeah, I think like interestingly, I'm glad you asked that question because I think that sort of answers the previous one as well of like that like how did I feel moving there? And I took so much time to be with the land and so much time to learn Costa Rican herbs. And, a lot of people down there import herbs from wherever. And I was like, no, like why are we importing North American herbs? Like the land, like this place is pure medicine. Everywhere you go, there's medicine and a very strong sort of indigenous plants there and indigenous medicine people. So yeah, I really spent time with people who knew the land and knew the plants and took time on my own way to form a relationship with those plants. And so it was an apothecary that was purely local as well. So it was wonderful. Like I have such a huge passion for plants, plant medicine, and IV therapy. So those for me are like my favorite modalities as a naturopath.
Yeah. And maybe that's a good transition then to IVs. What about IVs do you love so much?
Yeah, so I have been reflecting on that because interestingly, it's an intuitive, instinctual gravitation for me. Like I just love them, and I love doing them on people. I remember doing like the course and like learning, and some people, you're practicing and for the first time going to needle someone and people are like
Mhm.
this. And I'm just like, no, like, let's get in there. Like I never had the shake in my hands. I think this is not going to be, well, maybe I was going to say this isn't going to be so clinical sounding, but the idea of IVs really resonates with me because it's a medicine into our blood. And, as humans, you can live with a little less of your liver. You can live without a kidney. Your lungs regenerate themselves. Like there's bits and parts that can be cut away. Your blood, that's our vitality, right? Like that is our life force. That there is no human that runs without blood. Like no blood, no life, right? And a beautiful medicine to sort of gift your blood, especially in a we can chat about like how depleted people are, but it's just this like medicine like that we are gifting our body to our vitality, really, right? We are putting nutrients directly into our blood so they can saturate our cells and support cellular health. And so there's something about that just feels so incredible, in my opinions. I think that's what makes me gravitate so much is that like directness. Supplements, great. There's lots of pros to supplements, cons, but if someone's digestive system or absorption is suboptimal, we're not absorbing it, right? Like there's such an piece there that we're sort of skipping over. So I think that's the biggest thing is just people, it's just a way to support people at that cellular level and to support their vitality at such that foundational physical level.
Do you feel confused about what tests to ask for and how to interpret them? Because everyone keeps telling you everything looks fine, but you don't feel fine. We see you, and we have created a guide for that. I understand that women want to participate and take an active role in their health. And one way we can do that is starting to advocate for better, more comprehensive testing, but then also be able to be part of the conversation, whether or not those labs are within optimal range, not just within normal ranges. We have a guide, a lab test guide that walks you through the most common tests that can be done annually that will help you start to build this beautiful health binder on yourself so that you can co-create your health and you can start to see if imbalances arise and how to work with your health professionals in order to make a strategic plan to move the needle forward in our health. One of the most common things that are missed in the healthcare space, especially when we're feeling off, is this higher level conversation around more integrative testing and optimal ranges to help you feel your best. So no longer feel mystified. Go download our free lab test guide. The link is in the show notes, and use it to have more strategic and effective conversations with your health professionals. Enjoy.
Yeah. And I guess speaking of vitality too, coming back to Canada, what do you notice about the difference in vitality between maybe the community, the people that you saw in Costa Rica versus here? Like really different cultures and lifestyles. What kind of changes do you see in vitality?
Yeah, it's like two different worlds. Just two different worlds. Like the culture, the way people speak, the way people move through that world is so different. Like it was what I was saying, this idea of like instinct first. Like people are intuitive, and because you have to be, right? Like if you don't listen to your instinct and intuition, you will be in a dangerous situation, right? And here, I find that there's like people don't have that voice, right? Like we are so disconnected from nature, from wildness, you know? And sort of we don't lead with that intuitive and that inner voice and that instinct. I think, especially with AI and like ChatGPT, and there's so much noise, right? There's so much distraction here. There's so much noise that it's so hard to make your way. And it's to the point where it's like, is this real or is this not? Is this real? Like every day we're asking ourselves, you see a picture, is that real? Is that not? Is that real? Is that not? Like we're living in this interesting time. And so even more now than ever, like that instinct and intuition of like knowing what's true and not true.
Mm.
And so from a vitality perspective, like I think that dribbles down into our vitality. Like I
Mhm.
find people are that feeling like a little bit lost and disencouraged and unsure like what is the path. And we're so career focused here, so career focused. Like that is what drives people. That is the point of your day. That is, that the self gets so lost. And so people are burnt out.
Mhm.
People are a low vitality, like immune system. It shows up in your immune system. It shows up in your inflammation, right? Like autoimmunity is like a blurring of like, what actions does our immune system need to take? And so, yeah, I don't know if that answers the question, but
Definitely. Yeah. And I guess I wonder too, do you have any thoughts or advice about how someone here could maybe tap into some of those pieces a bit better or a bit more, like embracing more of that vitality or
Mm.
intuition? Any advice there or words of wisdom for people?
Yeah, well, I think that's where my journey really showed me. I think that there's many ways, but if I just use sort of the sharing I just did, what started first for me was like my body, right? Like getting back into honoring my body. And I'm someone that like all my life I've been into mindset. I've been into all of that sort of like good mental health, like always it's about your mind. And what my path showed me was how much actually like getting grounded and restoring the restoration of your body and optimizing yourself on such a physical level. Everything else can flow after that. Because if we are depleted and drained and exhausted and out of touch with ourselves, how are you going to make the transformation? Like, how are you going to make those shifts in life? How are you going to like change your mindset? And yeah, like reach whatever health goals, life goals, things that you want if you are just in depletion. And
Mm.
so for me, it's like really this getting back to your body and nourishing your body. And I think that's where IVs resonate with me so much because it's this way that we can just like support ourselves and restore our nutrient depletions. Like let's just take iron for an example. So many people, I have men, so I was going to say women, but like men, who are low in iron. You can take a supplement for 3 to 4 months and still not have your levels rise. Whereas with an IV treatment infusion of iron, you can get your levels up in 1 or 2 infusions. And so it's not about like the race and getting there as quick as possible, but it's realizing that, yeah, like we need to support ourselves on that cellular level and really that foundation in order to make all of those changes and everything else to flow.
Yeah. And one of the things that we're so excited about you bringing to the clinic is IV iron.
Yeah,
And
yeah.
yeah, and I agree. I mean, I see so many patients with iron deficiency who, just like you said, for some people, it's really challenging to get their iron up to adequate levels, and they
Yeah.
feel it, right? They
Yeah.
feel awful, they feel exhausted, and I think, infusions are such an easy way and just to optimize that and to help people feel so much better, so much faster. So
Yeah.
who do you generally recommend iron infusions for?
Yeah, I mean, definitely not everyone. It's not the kind of thing that I would be like, everyone will do well from this.
Mhm.
Whereas I would say I other IV nutrient therapies like vitamin C, Myers cocktail, like our adrenal formula, we have so many really general. Like obviously we do a really thorough intake to make sure that it's safe for you because there are obviously like anything, certain populations that maybe it's not ideal for based on their health condition. But that aside, like assuming it's safe, yeah, so many people can benefit from the general formulas of just nutrients, vitamin C, magnesium, zinc, selenium, taurine, things like that. But yeah, with specifically iron, I mean, I see patients. So, I mean, I'll just say this, if you are eating meat, the amount of patients that I see that are eating meat and low in iron. Like that shouldn't be the case. If you are eating meat, then you shouldn't be low in iron. You're either bleeding from somewhere or you're not absorbing it. You know, vegan, vegetarian, understandable. But if you are eating meat, that shouldn't be the case. And I have patients, I have seen them where they're taking Ferromax, which has, I think, like 350 milligrams of iron for a year, and their numbers haven't budged. Like you're not absorbing it whatsoever. Our gut can only absorb 1 to 2 grams of iron. So we're like throwing these supplements there, and there's only so much that can be absorbed. So yeah, there's a huge population of people that it is necessary, I would even say, and life-changing, because iron is the building block for our blood, you know, and that is our vitality, that is our life. And so, you know, the most common symptoms being depression, anxiety, poor quality sleep, hair loss, easy bruising, brain fog, and the list goes on. Yeah, and there's also scenarios too where your labs may come back normal. Like when we look at, you know, what's often just tested is your ferritin, which is your iron stores. But if there's inflammation happening in our body, it's not a true representation of what's actually available to your cells. It's just what you maybe have floating around, but it's not being used, it's not available. So yeah, this is where it's such a, I think, life-changing treatment for people who need it.
Yeah. And you mentioned Myers and vitamin C. When it comes to other IVs, so outside of iron, what are some of the common bags that you make for people? And how do you, what does that process look like in terms of
Yeah.
creating something for somebody?
Yeah. So I always do an intake with someone, obviously, you know, as I said, not to just assess their safety, but assess their health goals and what would be beneficial. So that's really the first step is just touching base that this is going to work, that we're open for this, and then we can dive into which ones. So we have some really amazing formulas that we offer, and then I can always add or take away certain ingredients depending on the individuality of the patient. But you know, there's the most famous, which is called Myers, which we sort of have a modified version of that. That's like our adrenal. So that's the burnout. That has everything from like B vitamins to magnesium, a little bit of vitamin C, zinc, things like that. So that's really for sort of replenishment and adrenal support, nervous system regulation, sleep, things like that. I have an immune push, and I have an immune bag, I guess you'd call it. And really, it's just timing, like one's small, one's larger. And it's like, how much time do we have for this? Some people can come in, you know, lunch break, quick immune boost, 10 or 15 minutes kind of thing for a smaller push, or we can do a longer treatment, which is the same similar formula, just a little bit bigger. And that has all of the typical things that are really good for supporting your immune system. So zinc, vitamin C, but the interesting ingredient is actually HCl, hydrochloric acid, which sounds intense, but it has so many great benefits in terms of really boosting white blood cells and initiating that immune response. So really good for someone who tends to have that, you know, if you're actively sick and we're wanting to kind of just help this along, for someone whose colds and flus or illnesses to last a really long time and they're just not clearing it out. So I really love that formula, especially in the winter. And then, of course, I have, you know, different variations of vitamin C. And so vitamin C has so much research on it in terms of inflammation, immune system, and we can do the higher doses, which is really wonderful. And then there's also one with a glutathione push. And that one I found a lot of people like because it does have a very great cosmetic benefit, which is like it creates a wonderful glow. So for women who want to have sort of that like natural, like it's incredible for anti-aging. And it gives you that really nice glow. So side benefit amongst the deeper sort of cellular benefits that has. And then I have, there's so many. I have a really good, what I've called sort of a longevity one. But this one's incredible. The ingredient that I love in that is taurine and high-dose glutathione. So those are really good for brain, so mental, like mood, clarity, cognition, healthy, you know, aging in the brain, memory, focus, really good for heart. And then taurine also has this wonderful benefit for supporting sort of detoxification and our triglycerides and blood sugar management. So
Wow.
it's a really good one as well in a, for example, a weight loss journey or that sort of metabolic syndrome type of picture.
Yeah. Wow. I didn't know about some of those longevity ingredients and
Yeah.
how, yeah. Wow. I'm excited to book an IV with you. Can
Yes.
you walk us through that process too? So, especially maybe for the people who are a little nervous about needles or about the process, what does that process look like for patients?
Yeah. So I'm trying to make it as simple as possible in that pretty much you book in. If it's your first time, we spend time just chatting. And that's my assessment that it's safe for you to do that. And I'll get your goals and we'll kind of create that plan. And I have some sort of initial treatments. So they're smaller bags so that, yeah, it's your first time ever getting an IV. It's not overwhelming in any way. It's like a 15 to 20 minutes. So we'll spend 15 to 20 minutes doing an assessment and maybe 15 to 20 minutes doing the IV just to get the ball rolling and to get that experience. And then afterwards, we can do a little bit longer of a treatment. And after that, I mean, I have patients that come weekly and I have patients that come twice a year. So it really depends on your health goals and where we're at. But I mean, in terms of that's just sort of a reference range of you can come more frequently than not during, an active goal that we're trying to achieve. And then typically one treatment is 30 to 45 minutes. And in terms of people who are nervous, I mean, yeah, at the end of the day, like you got to take a deep breath, right? But I try to make it as enjoyable as an experience as possible. You get a cup of tea. There's a nice, leaning, what is that called? Reclining chair.
Yeah.
Some nice music, always needing to eat beforehand. And I mean, one thing I always say to patients is like the needles that we use it's called a catheter. And so you use a needle just to access the vein, but I actually take it out and it's just like a flexible plastic tube that's there. The needle is not even in your body for more than like 10 seconds, like 5 seconds or less. So if you are nervous about that side of things, it's really as painless as it could be. A little pinch and then away we go. And then you just sort of sit back and relax, enjoy the experience. Yeah.
Yeah. Yeah. And I remember always mentioning that to patients too, that it's a needle for just a few seconds and then it's just a catheter in there.
Yeah.
And I think back to even the first few times I got an IV, I didn't realize that. And I thought that the needle was in. And so, you're holding your arm super straight and you're kind of
Yeah.
nervous. So
Exactly.
it is,
Like when people go to get blood, the needle's there the whole time. Like that hurts, it can be there for 5 minutes depending on how many
Yep.
vials you're getting. But yeah, when you get this, like it is quite a comfortable experience. It's one quick pinch and then the needle comes out and it's just a flexible tube. So you can move your arm. I mean, I wouldn't do exercises, but you can move your arm quite safely.
Yeah. Yeah. And how soon after an IV do people generally feel better? What does that look like?
Yeah. So, it's really different, obviously, for everybody and our starting point. So, if you're extremely depleted, I mean, I have patients that feel, or most people feel something like right away, that day, next 24 hours. I would say it's actually more of a question of like how long those benefits last.
Mm.
So people will come back to me and say, like, I've just had the best sleep of my life, like that night kind of thing. Or like Michelle is like super clear and energized and focused. Like she really loves that side of things. So everyone has sort of, I would say, a good immediate reaction. The immune one, it stimulates your immune system. So with that one, it sort of brings things on a little bit so that they can get rid of it. So when people are sick, and we do the immune push, I usually say like go home and like take that rest and take care of yourself, and then it will clear so much faster than had you not gotten that. So I would say that people feel something. Like I very rarely would I ever have a patient that's come back and said like, no, I didn't feel anything. But what people would say to me is like, oh yeah, I felt good for like 1 or 2 days and then I was back to my baseline. And so if that's the case, we really use that as a guiding symptom for our treatment. So usually I recommend anywhere from 4 to 6, just generally 4 to 6 treatments. give or take. And so the second treatment, for example, they'll say, oh, yeah, I felt good actually now for 3 to 5 days. Great. Then we do another. And then it's like, okay, I felt good for a week to a week and a half. And so that time frame expands and expands, the goal being you're just feeling good now, right? Like we've replenished you and you're able to have that energy and that really grounded health to then continue on. I'm not someone who I don't practice in a way that I want people to be dependent on things, supplements, herbs. He's like, the goal is not to have you there forever. The lifestyle stuff comes, but that takes time. And sometimes there's these hurdles that we're just not able to overcome, like you can't out supplement chronic stress, and so we need to take these more like bigger actions sometimes so that we can like break that vicious cycle, heal the gut, take that time to heal the gut. Then supplements are going to be more effective and then lifestyle comes in. So, yeah.
Yeah. Yeah, I think this is a really exciting intervention for a lot of people who are and maybe I'd love to actually hear you talk more about you talked about iron and absorption there and how that's where an infusion can be so beneficial. But what about people, let's say, who are taking like a B vitamin forever and maybe not really feeling much benefit? How could IVs that maybe have some of those same vitamins and nutrients have a different response?
Like they do have a different response, right? Because when we think about our bioavailability of whatever nutrient, when you take things orally, there's nothing that, correct me if I'm wrong, but nothing that I can think of that's like 100% absorption. Nothing.
Yeah.
So we take these supplements and I mean, for example, like iron, 1 to 2 grams, and there's people taking mega doses of iron every day, right? We eat, if you don't even take a supplement, you eat on average around like, if you're a meat eater, 7 to 20 grams of iron, and we're absorbing 1 to 2 grams. And that's without any digestive compromise. Now, how many people have digestive compromise? Percent? I mean, I'm throwing that figure out of my head, but like in my patient population, very rarely do I see someone who doesn't have some degree of digestive compromise. So that is the benefit of IV, is that it goes from like a small percentage of absorption and bioavailability into 100%. Like you're 100% absorbing all of that, all of the nutrients.
Yeah, that's great. I think that's so beneficial for so many people. And I remember too, back when Michelle and I were doing IVs a long time ago, one population, and there's so many populations that benefit, but one that I found over and over again, the population that really benefited was postpartum. Yeah, can you
Yes.
talk about that a little bit?
Yes. Well, postpartum, oh my God. That is an experience, like on a soul and a physical level, is you are at your most vulnerable and you're at your most depleted. I think in school, they had that statistic of like it takes a woman 3 years for her body to come back to the same nutritional status pre-pregnancy, and that's with supplementation. So 3 years for you to regain that nutritional status. And so there's so much talk about postpartum depression and all of that. There's multiple factors that are involved in that. But I mean, at bare minimum, nutrient repletion is so crucial. You know, women are often, it is such an vulnerable and depleted time. And then you're breastfeeding potentially and healing. And I mean, I would say many women don't have the support that they need. So we're then overworking, we're overgiving, and that's expensive biochemically on our system. Like when you are stressed and depleted and not sleeping, you're using more B vitamins, magnesium, nutrients. And so then you're even more in a depleted state. So I would say absolutely, that is one of the most important populations to help support during that time.
Yeah, so many big shifts. Absolutely.
Mhm.
And I think too, during that phase of life for so many women, the focus is so much on baby and baby's needs and all of the things that come with that. So I think, even being able to take that step back and think, what do I need in this
Yeah.
moment to support myself so that you can feel as good as you can feel and also show up as well as you can for the people in your life.
Absolutely. And I think that's what is sometimes the hardest part about postpartum is that I mean, I know I can speak from experience in that, you've just birthed this being, and they're so cute, a little alien looking, but like pretty cute. And you want to do all that you can, and you can just literally feel like your nervous system is in adrenaline mode for so long. You're like, and smelling, and like you're detoxing all these hormones, and you're just so low in iron and so low in all of the nutrients. You're trying to breastfeed, you're not sleeping. Like it is an intense time and a really like precious time and I think that's the disconnect is like then you're crying because of all of those things, but you're wanting to love this infant, this human being that you just brought into the world, and you're feeling so low, and you're feeling so like you're crying and all of those things, and you feel disgusting in your body, and so there's that like grief really in that disconnect of like wanting to be what you thought it would be and where you are. And so I mean, I think just even yeah, just supporting women from that perspective to heal and like absolutely, like it allows you and sets you up to sort of be closer to that of a mother that you want to be.
And you mentioned autoimmunity too. I mean, I'm seeing that more and more, especially with, I mean, a whole variety of autoimmune conditions, lots of Hashimoto's I'm seeing in practice with, so for those that don't know, thyroid antibodies. And can you touch a little bit on how IVs can support with autoimmunity?
Yeah, in so many ways. But I would say, obviously we're supporting the thyroid through X, Y, and Z. But from like an autoimmune perspective, it is really hard to get autoimmune titers down. It takes time, it takes rebuilding your immune system from the ground up, and I think that's where a lot of people get discouraged too is how long it takes. Like you can put an effort in for a month and you're not going to budge those numbers. Like at minimum takes like 6 to 12 months to begin to really shift those numbers. And so that's where, and we need to be doing interventions that are not just, a couple things here and there, so that's where IV vitamin C I have seen in practice made a huge difference for people's inflammatory markers and autoimmune markers. And again, it takes time. It's not overnight, but it's a game changer, I think, for helping with those numbers and helping people to sort of redirect and help support their immune system.
Yeah. Yeah, I think that's a game changer for a lot of patients, especially those that are working so hard, like you said, to get those antibodies down into those normal ranges. So it's a really exciting intervention
Yeah,
again.
and there's not a lot of things out there,
Yeah,
there's a
so
lot of
true.
things out there, I guess from like a conventional standpoint.
Yeah.
So, mushrooms is another incredible avenue. And I think that there's more and more research there, but, in terms of supporting your immune system on that really deep level. But I've seen some really wonderful results with high dose vitamin C.
Yeah, amazing. And so what do you see sort of as the future and where this is going with IVs at Poppy? What are your plans? What are you hoping to build out? What does this look like maybe a few years from now?
This episode is brought to you by the Poppy Clinic. If you're looking for an integrative approach, our team of naturopathic doctors is there to support you every step of the way. Whether you're looking to learn more about period literacy or hormone balance for your tweens and teens, or you're looking to optimize fertility during that perinatal and postpartum phase, or maybe you're at the phase where you want to start having a conversation around perimenopause and menopause, or even metabolic health, we have a naturopathic doctor for you, providing support with menopause hormone therapy, labs, an integrative, customized approach, talking about nutrition and movement, and even IV vitamin therapy. There is something here for you. So if you're looking for a more in-depth conversation, individualized approach, health education and empowerment, the Poppy Clinic is here for you. If you want to go learn more, check us out at Poppy Clinic.
Yeah, great question. I really want to dive into, well, which I think fits really well with the clinic, is that community. Because, you're sitting there getting an IV, and I think that what so many people are missing in their healthcare, not necessarily healthcare, but just health, sorry, their health in general, is that sense of community, right? We
Yep.
are so disconnected from each other. And so I'm working with Michelle to sort of dream up some ideas where we can have community IV events so people can come in, connect, and be with one another for, even though it's just 30 to 40 minutes, it's still 30 to 40 minutes that we didn't have, and everyone with these communal goals of supporting themselves and doing this health action, and then there's the connection piece. So I think that just amplifies the medicine.
Yeah, that's so exciting. And I think it's just like you said, right? Community, it really is such an overlooked aspect of healthcare. And it is something at Poppy that truly it's baked into everything that we do, right?
Yep.
Every single aspect, because we know the importance. We see so much transformation through community. And I think maybe that even goes back a little bit to your experiences in Costa Rica, where there is more of that community, right? And more focus on just each other and the land and support and nature, and less about kind of what you were saying about how here, the focus is so career and maybe more individualistic, but ways for us to get back to that. We know that that's such an important part of healthcare. And I think that building that into IVs, like two birds, one stone, right? Like
Yeah,
let's do both.
exactly. And just that in-person interaction,
Mhm.
like that's just really missing now and here. It is so hard to go out and just meet people, like where do you go? What do you do? How do you interact with humans? And even if you do go out, it's like everyone has their head down. And
Mhm.
so I think we need to go back to that, that just in-person interaction, even as friends. I mean,
Mhm.
even you and I here, right? Like podcasts back in the day, like you had to meet up and be in the
Mhm.
same physical space. And now, it's like separate. And
Yeah.
so it's this idea of just reigniting that in-person connection. And we don't need to be afraid of people and in-person things anymore. So
Yeah. Yeah, it's so true. I think that's one of the things that post-pandemic, we haven't really rebounded all
yeah.
that well, right? The world is still very much virtual. There's still
Yeah.
so much that we can do from the comfort of our own homes, which is comfortable, but
And efficient, it like I
yeah.
don't think we're gonna go back. I think it's not a we're going back, like, it's created this
Mhm.
efficiency, and so why go back,
Yeah,
But then there's that lacking of in person and
exactly.
yeah.
Yeah, and that connection piece is so important. Well, I'm really excited for all the things that you are bringing to the clinic, all of the wonderful knowledge that you have about this incredible way to support our community and build up our resilience, and like you said, really help us build capacity and even connect a little bit better. And something that I talk to patients about often is the bucket effect, right? And when we have so much in our bucket and things overflow and we get those symptoms. And I think IVs is a really incredible way to lower the water in the bucket, right? It gives us more capacity to handle things and make those lifestyle changes that are going to move the needle when we can decrease some of that physiological stress that our body might be feeling.
Absolutely. And I think the word that comes up for me when you say all of that is this idea of resilience, right?
Mhm.
Because life is hard, right? There's no way of putting it. There's challenges, life happens, and as it should be, right? It is just what it is. And there's challenges and things that we need to face on a day-to-day basis and responsibilities and all of that. And so that's not going away, but it's about our ability to regulate our nervous systems, and it's about resilience. And there is no resilience when we're depleted. Like you
Mhm.
just don't have the capacity to be resilient. And so yeah, it's I love that word, that,
Oh, me
and that concept of helping to support people in their resilience.
Absolutely. Well, thank you so much, Dr. Kersey, for coming on the podcast today and sharing all of your incredible experiences. You've had a really fascinating decade or so, right? Going through all of these experiences. And yeah, I'm so excited for all the things that you're bringing to the clinic and our community. And it's so wonderful to have you back. So thank you for being here today. And
Thank you
we will
so
put,
much.
yeah, my
Thank you. It was
pleasure.
an honor, and thank you for inviting me to share this space with you and get to know you. And I really look
Mhm.
forward to continuing the conversation. So thank you. I really, really appreciate it.
My pleasure. Well, thank you so much. And for everyone listening, if you would like to book an IV with Dr. Kirsty, we will have information in the show notes to do so. So thank you all for tuning in today. We hope that you enjoyed this episode, and we will see you next week.
Thank you so much for tuning in to Wild Medicine. I am so grateful to have you here, and I hope you're feeling inspired and empowered. If you enjoyed today's episode, please don't forget to subscribe and leave a 5-star rating. It helps us reach more incredible women just like you. And before you go, quick reminder, the information shared on this podcast is for educational purposes only and is not intended to diagnose or treat any medical condition. Please consult with your healthcare provider for personalized advice and care. And if you're ready to take inspired action and dive deeper into your own health journey, please visit us at poppyclinic.com. Let's rewild and reset your health together.